Your blood pressure could be seconds away from a crisis, and most people wouldn't even know it. A hypertensive emergency isn't just high blood pressure. It's a life-threatening spike that can damage your brain, heart, kidneys, and eyes in a matter of hours. The danger? The warning signs often look like everyday problems: a bad headache, blurry vision, or chest discomfort. Too many people dismiss these symptoms until it's too late. Doctors warn that missing these red flags can mean the difference between recovery and permanent damage. In this video, we'll reveal the 7 critical warning signs of a hypertensive emergency that you should never ignore. Knowing them could literally save your life or the life of someone you love. Disclaimer: this video is for educational purposes only. It's not medical advice. If you notice these symptoms, call emergency services immediately. Every minute counts. Now let's first understand what makes a hypertensive emergency so deadly. Understanding hypertensive emergency. High blood pressure is often called the silent killer because it usually has no obvious symptoms. But when it climbs into dangerous territory, it can trigger something far more serious: a hypertensive emergency. So what exactly is it? Doctors define a hypertensive emergency as a sudden, extreme spike in blood pressure, usually above 180 over 120 millimeters of mercury, that starts damaging your vital organs almost immediately. Unlike routine high blood pressure, which develops over years, this crisis strikes fast and can cause life-threatening complications in just minutes to hours. Here's the key difference. Hypertensive urgency means your blood pressure is dangerously high, but your organs are still okay, at least for now. Hypertensive emergency means that high pressure is actively injuring your body. Your brain, heart, eyes, or kidneys are under attack. Think of it like a dam that suddenly cracks under the pressure of too much water. At first, you may only see small leaks, but then the entire structure can collapse. That's exactly what happens inside your blood vessels when the pressure gets too high. They start breaking down. Why is it so dangerous? Because your blood vessels are only built to handle so much force. When the pressure explodes past that point, the delicate lining of your arteries begins to tear. This can trigger blood clots, swelling, or even rupture. The result? Stroke, heart attack, kidney failure, or sudden blindness. And here's the scary part. The body doesn't give you much warning. By the time symptoms appear, the damage is already underway. That's why doctors emphasize immediate action. Who's most at risk? Anyone with long-standing hypertension is vulnerable, but certain groups face higher risk. People who stop taking their blood pressure medications suddenly. Those with kidney disease, which makes it harder to regulate blood pressure. Pregnant women with preeclampsia. Individuals using certain drugs like cocaine or amphetamines, which can spike BP overnight. But the truth is, it can happen to anyone, even someone who's never been diagnosed with high blood pressure before. Many people ignore the early signals, assuming it's just stress, fatigue, or a bad day. But the difference between a mild symptom and a true warning sign can be life or death. That's why recognizing the 7 red flags is so important. So here's the question. If your brain was seconds away from a stroke, would you know the difference between a harmless headache and the kind that signals emergency? In the next section, we'll uncover the first warning sign of a hypertensive emergency, one of the most common yet most dangerous symptoms people dismiss. Warning sign number 1, sudden severe headache. Almost everyone experiences headaches from time to time. Stress, dehydration, eye strain, they can all trigger head pain. But the kind of headache linked to a hypertensive emergency is different, and dangerously so. Doctors often describe it as a thunderclap headache. Why that name? Because it comes on suddenly like a clap of thunder and hits with an intensity that feels explosive. This isn't a dull ache that slowly builds. It's a crushing, severe pain that can appear out of nowhere and reach maximum intensity within seconds to minutes. When blood pressure spikes dangerously high, it increases the force inside the small blood vessels in your brain. That extreme pressure can stretch and irritate the vessel walls, leading to swelling or even tiny leaks of blood. In some cases, it's a sign that the brain is on the verge of a stroke or bleeding. Think of it like a balloon being overinflated. For a while it stretches, but at some point it can't handle the pressure anymore. Your brain's blood vessels face the same risk during a hypertensive emergency. How is it different from a regular headache? Timing: a hypertensive emergency headache strikes suddenly without warning. Severity: it's often described as the worst headache of someone's life. Associated symptoms: it can be accompanied by nausea, vision changes, confusion, or weakness. A tension headache might fade with rest, hydration, or painkillers. But if your headache feels unbearable, arrives suddenly, and doesn't improve with typical remedies, that's a massive red flag. What should you do? Here's the most important takeaway. Never ignore a thunderclap headache. If you or someone around you experiences one, especially if you have a history of high blood pressure, seek emergency care immediately. This is not a wait-and-see situation. Emergency doctors often say, time is brain. Every minute of delay during a hypertensive emergency increases the risk of permanent damage. Would you know the difference between a normal migraine and the kind of headache that signals your blood vessels are seconds away from rupture? That distinction could save your life. And this was just the first warning sign. Warning sign number 2, vision problems. One of the scariest and most overlooked warning signs of a hypertensive emergency is a sudden change in vision. Many people dismiss blurry eyesight as fatigue, too much screen time, or needing new glasses. But when blood pressure spikes into dangerous territory, your eyes often become one of the first organs to show signs of trouble. Your eyes are full of tiny, delicate blood vessels, especially in the retina, the thin layer at the back of your eye responsible for vision. When blood pressure rises sharply, those fragile vessels can swell, rupture, or leak fluid. Doctors call this hypertensive retinopathy. The result? Blurred vision, double vision, flashing lights, or even sudden blindness. Some people describe it as if a dark curtain suddenly dropped over their eyesight. In extreme cases, dangerously high blood pressure can cause swelling of the optic nerve, a condition known as papilledema. This is a medical emergency that signals your brain itself is under intense pressure. How is it different from normal eye strain? Eye strain from working on a computer may cause mild discomfort, but it usually improves with rest. Hypertensive emergency vision problems appear suddenly, are often severe, and do not fade with rest or eye drops. Key red flags include sudden blurry vision or double vision, loss of part of your visual field, like blind spots or tunnel vision, seeing flashing lights, dark spots, or halos, complete or partial sudden vision loss in one or both eyes. Why this matters so much? Losing your vision is not just an inconvenience, it's a sign your blood vessels are under catastrophic stress. In fact, sudden blindness from a hypertensive crisis is often accompanied by other organ damage, like kidney failure or stroke. Ignoring it could mean permanent vision loss, or worse, a life-threatening complication in another part of your body. If your vision changes suddenly and you have high blood pressure, treat it as an emergency. Don't wait for an eye doctor appointment. Call emergency services immediately. Quick action can preserve your eyesight and protect your brain from further damage. Would you recognize the difference between harmless, tired eyes and the kind of vision change that signals your body is seconds away from catastrophe? That knowledge could save your sight and your life. Warning sign number 3, chest pain or pressure. Few symptoms are as alarming as chest pain, and for good reason. During a hypertensive emergency, the heart is under extreme pressure, forced to pump against dangerously high resistance in the arteries. This can trigger life-threatening conditions within minutes. When blood pressure spikes, the arteries supplying your heart, called the coronary arteries, may not get enough oxygen-rich blood through. This leads to angina, or, in severe cases, a heart attack. Even more frightening, uncontrolled hypertension can cause an aortic dissection, a tear in the body's largest blood vessel, the aorta. This is a medical catastrophe that can be fatal if not treated immediately. What does it feel like? People describe hypertensive emergency chest pain as crushing or squeezing pressure in the chest, pain radiating to the jaw, neck, shoulder, or left arm, a heavy weight as if an elephant is sitting on the chest. Unlike mild heartburn or anxiety, this pain doesn't fade quickly. It often comes with other symptoms like sweating, shortness of breath, nausea, or dizziness. Ignoring chest pain during a hypertensive emergency is one of the deadliest mistakes a person can make. Doctors stress that if your chest feels like it's being crushed, your body is telling you something critical. Your heart is in danger. If chest pain or pressure hits you suddenly, especially if you have high blood pressure, call emergency services immediately. Don't attempt to tough it out or drive yourself. Every minute matters. Would you know the difference between simple indigestion and chest pain that signals your heart could stop at any moment? Recognizing that difference could save your life. Warning sign number 4, shortness of breath. Breathing is something we often take for granted until it suddenly becomes difficult. Shortness of breath is another warning sign of a hypertensive emergency that should never be ignored. When blood pressure skyrockets, the heart has to pump harder than ever. Over time, this strain can weaken the heart's ability to function. During a crisis, it may fail to keep up, leading to fluid buildup in the lungs, a condition known as pulmonary edema. The result? You may feel like you're drowning, even while sitting still. What does it feel like? Difficulty catching your breath, even at rest. Gasping for air or needing to sit upright to breathe. Wheezing, coughing, or frothy sputum in severe cases. A feeling of tightness or suffocation. Unlike shortness of breath from exercise or anxiety, this symptom doesn't fade with rest. It usually appears suddenly and worsens quickly. Shortness of breath during a hypertensive emergency is a clear sign your heart and lungs are failing under extreme pressure. Left untreated, this can progress to full-blown heart failure or respiratory collapse. If you suddenly feel like you can't breathe, don't wait it out. Call emergency services immediately. Emergency doctors often say, when you can't breathe, your body is already screaming for help. Would you brush off breathlessness as simple fatigue, or recognize it as your heart's desperate cry for help? Knowing the difference could mean the difference between life and death. Warning sign number 5, neurological symptoms. When blood pressure rises into emergency levels, one of the first organs to suffer is the brain. This is why neurological symptoms are among the most dangerous warning signs of a hypertensive emergency. Unfortunately, they're also some of the easiest to overlook or confuse with less serious issues. A sudden spike in blood pressure can damage tiny blood vessels in the brain, leading to swelling, bleeding, or even blood clots. This increases the risk of stroke, seizures, or a condition known as hypertensive encephalopathy, where the brain literally becomes overwhelmed by pressure. Symptoms to look for: confusion or disorientation, feeling suddenly lost, not knowing where you are, or struggling to follow a simple conversation. Difficulty speaking or slurred speech, words may come out jumbled, or you may suddenly find it hard to form sentences. Weakness or numbness, especially on one side of the body, face drooping, or inability to lift an arm. Seizures, uncontrolled shaking, or loss of consciousness. Sudden severe dizziness or loss of balance. These aren't just signs of fatigue or stress. They're often the earliest clues that your brain is being damaged by extreme pressure. How is it different from everyday forgetfulness or tiredness? Most people forget names, feel groggy, or get clumsy now and then. But neurological symptoms linked to hypertensive emergencies appear suddenly, severely, and without warning. They don't improve with rest, hydration, or food. For example, if someone suddenly slurs their speech while talking normally just moments before, that is not simple exhaustion. It could be a stroke in progress. The brain is incredibly sensitive to oxygen supply. Just a few minutes of interrupted blood flow can cause permanent damage. This is why doctors use the phrase, time lost is brain lost. If you or someone near you suddenly develops confusion, slurred speech, weakness, or seizures, don't wait. Call emergency services right away. The faster the blood pressure is controlled and treatment begins, the higher the chances of survival and recovery. Would you know if a loved one's confusion was harmless tiredness or the first sign their brain was shutting down? Spotting the difference could save their future or even their life. Warning sign number 6, nausea, vomiting, and severe anxiety. When people think of a hypertensive emergency, they often imagine dramatic symptoms like chest pain or fainting, but sometimes the body's warning signals are more subtle, and that makes them especially dangerous to overlook. During a hypertensive emergency, the sudden spike in blood pressure places extreme stress on the nervous system and vital organs. This can trigger nausea, vomiting, and overwhelming feelings of anxiety or impending doom. The nausea and vomiting occur because the brain's pressure-sensitive centers, which control both balance and digestion, are affected by the strain of high blood pressure. Severe anxiety arises because your body is essentially going into crisis mode, releasing stress hormones like adrenaline. How is it different from an ordinary stomach upset? A simple stomach bug or mild stress might make you feel queasy, but it usually improves with rest, hydration, or medication. In contrast, nausea and vomiting linked to a hypertensive emergency appear suddenly, often alongside other symptoms like a crushing headache, chest pain, or vision changes. The key red flag: this isn't ordinary food poisoning or nerves. It comes out of nowhere and feels extreme. The role of severe anxiety. Doctors often note that patients in hypertensive crises describe a sudden, intense feeling that something is very wrong, or even, I feel like I'm about to die. This isn't normal stress. It's your body sending an emergency alarm. If you experience sudden nausea, vomiting, or unexplained severe anxiety, especially with known high blood pressure, don't dismiss it. Treat it as an urgent warning and call emergency services right away. Would you write off sudden vomiting or panic as just stress, not realizing your blood pressure was seconds from catastrophe? That mistake could cost a life. Warning sign number 7, nosebleeds and organ damage clues. Nosebleeds might seem harmless. Many people get them from dry air, allergies, or minor irritation. But during a hypertensive emergency, a sudden severe nosebleed can be a sign of something much more dangerous. Extremely high blood pressure puts enormous strain on the delicate blood vessels inside the nose. When these tiny vessels can't handle the pressure, they rupture, leading to heavy, hard-to-control bleeding. But nosebleeds aren't the only clue. Hypertensive emergencies often cause silent damage to organs like the kidneys and liver. Warning signs of this hidden damage can include blood in the urine or dark, foamy urine, very little urine output despite drinking fluids, unexplained swelling in the legs, ankles, or around the eyes. These symptoms mean that the high pressure has already begun to overwhelm the body's filtration and circulation systems. A simple, light nosebleed isn't always a crisis, but in the setting of extremely high blood pressure, especially when combined with other symptoms, it can be the body's last warning before catastrophic organ failure. Ignoring these clues allows the damage to spread silently, often leading to kidney failure, stroke, or heart attack. If you experience a sudden, severe nosebleed that won't stop, or notice blood in your urine while dealing with high blood pressure, treat it as an emergency. Don't wait for it to pass. Call emergency services and get help immediately. Would you see a nosebleed as just dryness, not realizing your blood vessels were screaming for help? That tiny trickle could be your body's final warning. What to do if you notice these signs? So now you know the 7 critical warning signs of a hypertensive emergency. But here's the most important part. What should you do if you or someone you love experiences these symptoms? 1. Call emergency services immediately. First and foremost, don't wait. Don't Google. Don't ask friends. Call emergency services right away. Whether it's 911 in the US or your local emergency number elsewhere, time is everything. Why? Because during a hypertensive emergency, every minute your blood pressure stays dangerously high is another minute of damage to your brain, heart, kidneys, or eyes. Doctors warn, you can replace a car, you can't replace your brain. Trying to drive yourself to the hospital is risky and wastes precious time. Always call for professional help. 2. Do not try to fix it at home. One of the biggest mistakes people make is reaching for their blood pressure pills and thinking, I'll just take an extra dose and wait it out. This can actually be dangerous. Some blood pressure medications work slowly, while others, if taken incorrectly, can cause your blood pressure to drop too quickly, leading to shock or organ failure. The right treatment for a hypertensive emergency requires intravenous medications that work fast and can be carefully adjusted by doctors in a hospital setting. 3. Stay calm, but don't delay. Easier said than done, right? But panicking raises adrenaline, which can push blood pressure even higher. While you wait for help to arrive, sit down in a safe, upright position. Take slow, deep breaths. Avoid eating, drinking, or moving too much. 4. Know what not to do. Don't drive yourself if you're experiencing chest pain, vision loss, or confusion. Don't ignore symptoms, hoping they'll pass. Don't delay because you're too busy or don't want to make a fuss. Hypertensive emergencies don't wait for your schedule. 5. Why acting quickly saves lives. When treated in time, many people survive a hypertensive emergency and prevent permanent damage. But delays, even just an hour or two, can mean the difference between walking out of the hospital or living with lifelong complications like stroke, blindness, or kidney failure. Think of it this way. Acting fast doesn't just save minutes, it saves futures. So here's the big question. If these signs happen to you tonight, would you know exactly what to do? Now you do, and that knowledge could save your life. Conclusion. A hypertensive emergency is not just high blood pressure. It's a life-threatening crisis that can damage your brain, heart, kidneys, and eyes in a matter of hours. The 7 warning signs we covered, from sudden severe headaches and vision loss, to chest pain, shortness of breath, neurological symptoms, unexplained nausea, severe nosebleeds, and organ damage clues, are your body's way of screaming for help. The most important takeaway, never ignore these symptoms. Don't try to fix it at home, and don't wait for them to pass. If you or someone you know experiences these signs, call emergency services immediately. Acting fast can save not just your life, but your future. Now here's what you can do next. If you found this video helpful, hit the like button. It lets us know this content is saving lives. Now, subscribe to our channel and turn on the notification bell so you never miss important, doctor-approved health information. Share this video with your family and friends. You never know, this knowledge could save someone's life. And I want to hear from you. Have you or someone you know ever experienced one of these warning signs? Share your story in the comments below. Your experience might help others take these symptoms seriously. Remember, when it comes to hypertensive emergencies, every second matters. Stay informed, stay prepared, and take care of your health, because your life is worth protecting.